Assalamu alaikum. Bismillahirrahmanirrahim. Today we are going to do the talks series. And see, for me, always the motive is life is a series of thousands of tiny miracles. Please notice them. I am Dr. Lisa Ali from online learning educational free group, Tawakkal group, and this is the topic which we are supposed to do today is the abnormal amniotic fluid in pregnancy. This article we are going to do as a summary and the some in detail. This is the talk of the January 2026 volume number 28, and the issue is number 1. So now we have to do we have to understand one thing before we start this topic. I mean article. There is no guideline until now. There is no guideline produced by the Royal College and the RCPI. They did not produce this guideline until now, but this is the first time they given it very nicely in detail about that topic, and very nice table and the algorithm they have given. So we are going to discuss about them. The article is already in the group free library, so you can take this article from there, but I will try my best to give you some overview of that top article. So we can see, we will start from there. This is the many. First, we have to understand what is this meaning of abnormal amniotic fluid in pregnancy. Abnormal amniotic fluid means they want to discuss about the oligohydramnios, polyhydramnios, and anhydramnios. Anhydramnios, they are not so much concerned. The whole article of this January 2026, this TOG article, they mostly discuss about the oligohydramnios and polyhydramnios, and really, it is a very nicely written article. And a very new information they have given to us. So we will start from there, that we have to understand that we just have to know about some knowledge that the amniotic fluid is they want to discuss oligohydramnios and the polyhydramnios. What is the meaning of oligohydramnios? Means too little fluid and too much little fluid, just in a normal layman language I will talk to it. So what is the function of this amniotic fluid? If we will consider about this picture, they say it will be the fetal protection, it will allow the movement of the fetus, and then it will prevent the cord compression, and it will support the cord compression. So, and then the last one is the lung development. So now, if we will consider both of them, I'm just giving you a please a little overview so you can understand, and in the last we will discuss about the algorithms and the table of that article. So polyhydramnios, what they want to see, and we have to understand that thing, that these are some very important MCQs I'm telling you on this line side by side. So polyhydramnios means amniotic fluid volume index more than 25 centimeter, and the single deepest volume of this pocket. Okay, more than 8 centimeters. So this is one of the very important MCQ. Another MCQ they can ask it, what is the meaning of this? What is this oligohydramnios? Oligohydramnios amniotic fluid index less than 5 centimeter, and the single deepest volume of this pocket is less than 2 centimeter. We have to understand one thing, what is this meaning of amniotic fluid index and single deepest volume. Amniotic fluid index means they will measure, see, they make the line here. If you are looking here, there are 4 quadrants. They divided this tummy into mama tummy into 4 quadrants, 1 2 3 4. So they will measure here how much the fluid is there. This one they will measure, this one they will, and then they will calculate it in a one, they will plus it, and then they say it is amniotic fluid index. So that's why it is a sum of that 4 quadrant. And single deepest volume pocket means only in the four quadrants, only one quadrant they are going to take it, because if we will take this four quadrants measurement, it will take the time. So they want to save the time also, so they that's why they say single deepest volume or this one pocket. Okay ji. So what is the causes? These are the causes they have given. Polyhydramnios causes, if we will consider the maternal causes, are the diabetes, renal pockets, fetal is the GIT obstruction, brain anomalies, and idiopathic causes. The oligohydramnios, the causes is maternal will be the hypertension, dehydration. Fetal causes is the renal issues and the growth restriction. So these are the causes we will go. And then if we will consider about the management polyhydramnios, we will monitor and consider early delivery. And oligohydramnios increase monitoring and plan delivery timing. So we will discuss all the algorithm which we have done. First, we have to understand what is this amniotic fluid. What is this importance of the amniotic fluid? Amniotic fluid is the physiologically dynamic, regulated compartment. It is essential for the fetal development. So, for the concern, for our concern, these abnormalities in volumes like oligohydramnios and polyhydramnios, it will reflect the disruption in production. So means, what is this meaning? This meaning means no, there is a disruption of the fluid production. We have to understand that thing. Means normal fluid is not there, oligo is not normal, poly is not normal. So so it means there is a disruption in the production. It will produce very less or it will produce more. So the removal balance and are associated with adverse. So it means we have to understand this, all the abnormalities which we are getting, this abnormal fluid abnormalities. So what they will going to do? They will going to make the adverse prenatal outcome. Okay. So the diagnose, how we are going to diagnose, this is most important MCQ. The diagnose relies on the ultrasound assessment, because amniotic fluid volume we cannot see through, we don't have a laser eyes beam. So we can check through in the tummy of the mama how much the fluid is having. So we have to rely upon the ultrasound. The ultrasound assessment we will do, and then the management we will consider upon, it will depend upon the severity, what is the gestational age of the fetus, and what is the underlying cause. So now we understand. So this is the whole dynamic about the this amniotic fluid, this topic. Okay, now if we will go, now we will go to them about the means every topic we are going to do. Now the introduction means what? What is this amniotic fluid do? Amniotic fluid will provide the mechanical protection, thermoregulation, infection barrier, and facilitate the lungs and the musculoskeletal development. Please remember this thing. What is the means benefit of having the amniotic fluid? Okay, now this is a very important question, MCQ question. How this amniotic fluid is formed or regulated? It will produce by the fetal urine and the lungs fluid. So these two fluids are the most important one of fetal urine and the fetal lung fluid. Okay, ji. So how this amniotic fluid is removed? By the fetal swelling and intramembranous absorption. So means what he wants to say? He is telling how it is produced and how it will be removed. Okay. So see, for the removal of the amniotic fluid, fetal swelling has to be there. So if there is a problem in the GIT of the fetus, the swelling will not go. So what will happen? The fluid will not be removed. So it will accumulate and it will going to be have a polyhydramnios. So this he say, if they will cause the disruption will be decreased volume. If decreased volume will be there, we call it oligohydramnios. If increased volume, we will call it polyhydramnios. I hope it is understand. Okay, this is the very important question, and this is a very normal MCQs. He say, if we will consider about the physiology of the amniotic fluid, and these headings are according to the these TOG articles. So, if we will consider the physiology, the peak amniotic fluid will be at 36 to 37 week. It will be 800 to 1000 ml. This is the one we have to know. After mid pregnancy, after mid pregnancy, okay, the fetal, what is the main source of the amniotic fluid? Fetal urine is the main source, and how it is will be clear in the body. It will clear by the fetal swelling, means he is engulfing that fluid. Okay, what is the important, this is what is the main important of this amniotic fluid? It will marker of fetal well-being, because if the fetal will floating in that fluid, or it is drinking that fluid, so the baby will be alive. So it means the baby fetal well-being, this is a marker that it is a fetal well-being, the fetus is okay. Okay, because you see, if there is a fetal oligohydramnios is less, baby cannot move. If baby is not moving, which will we make it? We will say it is a decreased fetal movement. If the decreased fetal movement will be there, how long she can cope with the decreased fetal movement? It is means the baby has to die. Eventually, baby has to die. And if it is a polyhydramnios will be, it is not so much dangerous as the oligohydramnios. We have to remember that thing. Okay, now the definition and the classification. This depends upon the ultrasound. Ultrasound is the one who is going to do. Oligohydramnios means amniotic fluid index less than 5 centimeter. See the difference here. The index means it will be 4 quadrant. As I already told you, this 4 quadrant, this is the our four quadrants are the one here, the four quadrants are major, that's why it is more. But if you will consider only one pocket, it has to be less. So the one pocket means it is less than 2 centimeter, and if it is four quadrant, if we are measuring AFI, so it has to be less than 5 centimeter. Oligo means, okay, oligo means less than 5 centimeter amniotic fluid index, and single deepest pocket will be less than 2 centimeter. Now if normal, how much we will say, what is the normal? Normal has to be, amniotic fluid index normal has to be 5 to 24. So we have to remember this value of 5. Amniotic fluid index less than 5 means it will be oligo and it will be more than 24, it will be polyhydramnios. See the definition they give in it. Polyhydramnios amniotic fluid index 24 to 25, or the single deepest volume pocket will be what? More than 8 centimeters. So these definitions are very, very important for the this one MCQs. Okay, means SBA MCQs or SBAs. Okay. Now they also given the severity of the polyhydramnios. This definition they want to give it. Mild, most common is the one, and it is idiopathic. Mild, moderate, and severe. Okay, ji. So these are the one they want to tell us. Okay, ji. Now we will. If we will go to the etiology and pathology. Patho. Okay, now we will consider oligo. First means if there is a decreased production or increased loss. So this is the reason the baby has a oligohydramnios, means it is not producing, or if it is producing, there will be more loss. The loss will be what? How the baby, maybe they have a rupture of membrane, maybe a point is leaking and leaking like our tap, if it is open, and sometimes there is only tip means only drop is going on. So this is the one, and the important one is the, this is the one causes. Here I write it only the important causes, which is very important for the MCQ point of view, but there is a big list of the causes of that one. Okay, if we will go to see this causes, here we can see it here. This is the causes of the polyhydramnios. See, I will consider the severity. Severity means mild means more than this amniotic fluid index, or single means single pocket. They are talking single deepest vertical pool, or the pocket they can say it. Mild means more than 4 to less than 12, and if it is increased, index is increased more than 24. Okay, more than 24 to less than 30. Moderate more than 12 and severe more than 16. This will be polyhydramnios. Okay, and now the one which we are talking about, first we are doing this one only, the first topic we started now, we started with that topic. We are starting now. We are doing this oligohydramnios, the first topic which we are consider about the oligohydramnios. I am showing you the list of the causes of oligohydramnios. This is the polyhydramnios. We are looking for the oligohydramnios. This is also the poly. Now it will start the oligo. He say, see, what is the maternal and fetal association? This is also the polyhydramnios. Okay. Now we are getting here. The causes of the oligohydramnios, they divided into the maternal causes and they divided into the fetal causes. Big list. Okay. So if we, first we have to consider about the maternal causes. Maternal causes means placental disorders. So we have to know what are the placental disorders. It can be PED, it can be pregnancy induced hypertension, essential hypertension, or maybe she is having some nephrological problem, or disruption to the maternal fluid state, means like anorexia nervosa, hyperemesis gravidae, means she is vomiting and maybe she is dehydrated. So this is one of the causes of the oligohydramnios. And if we will consider about the fetal causes, fetal infection like torch, we will come medication, age, angiotensin converting enzyme. Okay, she is taking, and she is taking non-steroidal anti-inflammatory medication. This is one of the cause of oligohydramnios. And chromosomal abnormalities, she can have fetal structure abnormal. There is a big list. So that's the reason I try. That's what I am showing you. So I try to make that, get it here. I written it here only the causes which are most important, because there is a big list, so most important causes it's there. So what is that one? This one, the placental insufficiency, FGR, post-term pregnancy. We have to remember post-term pregnancy, and the most important pre-labor rupture of membrane. This is also very important cause of the oligohydramnios. Okay, Ji, if I may, the most in, this is a very important MCQ. This one, the fetal anomalies like renal agenesis and renal agenesis. Fetal renal anomalies means renal agenesis. It will lead to the less urine production. Anybody who is having a kidney problem, they have to have a less urine production. So these are the causes, most important causes we have to remember. If you like, you can take from this list some uh, important things if you like. This is your choice. Okay. So we done up to here the causes of the oligohydramnios. Now we'll go to the polyhydramnios. Polyhydramnios means there is encouraged production of the fetal urine. So it can be a less production. Less means it will be oligo, and more means poly. Or there is a decreased swelling. See, the baby is not swallowing any fluid. So decreased swelling will make the polyhydramnios. Where is the fluid has to go. So now if we will consider about the causes, here about the causes, we have to think about the causes. And what we are going to hear, the maternal diabetic, one of the causes, structure abnormalities, fetus like GIT anomalies, obstruction, twin to twin transfusion syndrome, fetal anemia, and idiopathic. And this is the most important cause of that one. We have to remember that one most important one is the idiopathic, and this is a very important MCQ question. So idiopathic, how much it will be? 60 to 70%. Okay, remember that figure. Okay, and the swelling failure or excess urination, it will cause the accumulation of the fluid. Okay, what will be the features we are going to get it? If it is oligohydramnios, the baby will be small for days, reduced fetal movement, and associated with fetal compromise. So we have to understand that thing. See, if there is a less like fluid, if there is a some pole there, if there is a lacquer is less, so somebody wants to make a swimming, they cannot make it very less small water. So this is the thing, we have to remember the name. And if we will go for the clinical features of the polyhydramnios, the baby will be large for gestational age or large for days, uterus will be there, mother will feel the discomfort, she will feel the dyspnea, because if she has a very big tummy, so she is will going to be have a problem of breathing, dyspnea. And often some, if it is a mild case na, the polyhydramnios, if it is a mild, just now we done the severity na, so if it is a mild case, then it mostly they are asymptomatic. Okay. Now we will go to complication. Complication means what? Fetal complication, that's the same thing, oligo and poly. Oligo complication is what? Pulmonary hyperplasia means in early pregnancy, cord compression and stillbirth chances are in. Because why stillbirth chances are increasing? Because we have to remember that the baby has no movement. The where is the movement gone? So the oxygenation will not go. So baby will have to be bye bye. So there will be increased risk. Okay. And if we will consider about the polyhydramnios, there will be a fetal restat, fetal malformation, congenital abnormalities. If we will consider in polyhydramnios, congenital anomalies only 20%. Okay. Maternal and obstetric means increase what they need it. What in this, if they have oligohydramnios or polyhydramnios, what they are going to do. In oligohydramnios, increased intervention will be there, and this is a, please remember this thing. There is a very important MCQ. If there is a oligohydramnios in the maternal obstetrical complication, what we are going to do with it, it will be an increased intervention will be there, like induction and the cesarean section. If it is a polyhydramnios, there will be a preterm labor, cord prolapse, and postpartum hemorrhage. Please remember this small one. If we will go for the investigation, first line investigation is the ultrasound, always ultrasound, because we have to measure the amniotic fluid index and the this SDF, single deep pocket or a pool, we can say like this. Okay. Further, what we will do this thing further, this is the investigation. First line investigation is the ultrasound. Then what other further investigation? We have to do the detailed anomaly scan, maternal diabetic screening, infection screening. What is this? All screening means we have to identify the cause. Okay, what will be the management? Management depends individualized, na? If she is having a oligohydramnios, then she needs to have since antenatal care, she has to have a serial growth plus Doppler surveillance, CTG monitoring, and we have to deliver her if she is at term and there is a fetal compromise. So the fetal compromise, the gestational age we have to say. If it is a polyhydramnios, she has to, mild means if mild, she is having a mild poly, we have to do the expectant management, and we will try to treat the underlying cause like diabetes. If it is in the severe cases, what we are going to do, polyhydramnios, we will do the amnio reduction, and we have to do the early delivery. Okay, this one we have to do. What will be the prognosis? Prognosis depends on the cause plus severity. Mild polyhydramnios, it has often a benign one, and the prognosis is good. But if we will talk about the oligohydramnios, higher association with fetal compromise, because oligo mirror how the baby is surviving, how the baby is moving, how the baby is taking the fluid, swallowing the fluid, how her baby body is working. So that's why oligo is the one, higher association with fetal compromise, and this is the very important MCQs. So both condition linked to the increased prenatal morbidity. We have to understand. So this is the thing. Now I will show you this, the one which I explained you. This all the thing. These are the one which we explained. The mile is there, which I explained already. Causes we already done. So whatever cause you like it, you remember that cause. That's the only thing which I am doing. If you like, you can do like this thing also. Okay. So maternal causes of the polyhydramnios: diabetes, obese woman, maternal uremia, and alloimmunization. This alloimmunization, don't forget, this is also, remember, if she is having a fetal hydrops. And what are the fetal causes of the polyhydramnios? Fetal infection, chromosomal abnormalities, okay, structure abnormalities, the structure abnormalities in neuromuscular means an encephaly baby and the Dandy Walker syndrome. Okay, the, we are not supposed to remember this very hard word. GIT obstruction. Okay, this the one. This is the most important cause. This one, renal or the urinary. Okay, and this is the first algorithm which actually this RCOG they produce it. So if she is having a polyhydramnios, what we have to have it? What is that definition? Which we already they make it in that tablet. Sorry, in the algorithm form. Single deepest volume a pocket or a pool is more than 8 centimeter, and amniotic fluid index more than 25. So this definition we have to remember by heart. So what we do, we have to take a detailed medical history, including, and this will be for the theory point of view. We already explain all the things there. See, one important thing here, we have to understand that torch screening and the renal function tested we don't do routinely. We will do only if the we are suspecting that she is the maternal having a renal failure or renal problem, and she is Rh negative, or this one we have to know that status, and then means we will understand that thing. Maybe she is having a alloimmunization. So this is the thing we have to remember this thing. Huh? So this already we know it, and they say if she is having a positive infection screen, we will do baby will be FGR or SGA, or severe polyhydramnios we can get it. So we will consider referral to the fetal medicine unit. Okay, so this is the polyhydramnios, and now we will consider about the this is the also the maternal and association, the means the the means the risk or the any disease associated with that. If there is an increased induction of labor, the fetal will be macrosomic baby, the association. Okay. Prolonged first stage means the baby will have a transient tachypnea of the newborn. So anything you would like to read it, you can remember that way. Now he is talking about the causes of the oligohydramnios. Placental disorder like PET, preeclampsia and nephropathy, the one which we already done. Anorexia nervosa means vomiting all the time. Maternal dehydration, and the fetal causes what? Fetal infection, the toxo, rubella, the torch one we have to talk. Medication what? ACR, ACE, I inhibitors, okay, angiotensin converting enzyme inhibitors. Chromosomal anomalies, okay, fetal structure anomaly. So the renal agenesis is the most important one. You have to remember that's the one of the causes. This one there. Okay, so the complication we already done, maternal and fetal complication of oligo. There will be increased risk of asphyxiating the birth, because oligo babies start to have a compromise. Baby can have a meconium stent like and choriomnitis will be there if she is baby having a preterm rupture of membrane will be there. So this we finish it. This is oligohydramnios. This is the same table. So my last thing is that thank you so much. We finish, Alhamdulillah, we finished that article summary to understand, and then afterwards I will put also the CPD of this topic in our group. So the life is the last my message is that life is a series of thousands of tiny miracles. We have to notice them. I am Dr. Liza Ali. Assalamu alaikum. Bye bye.